Thanks everyone for coming out again on this beautiful day. Brian, for helping me to understand one of the other benefits of growing old, and that is watching people who you saw as a relative youngster and worked with turn into such an adept individual. So Brian and I used to get in the car from the University of Vermont and go over to rural communities in New York State and try and convince them that we were a good place for them to send their referrals, because Vermont, with the same number of people literally as Wyoming, but had a medical school that was trying to support itself within its borders. So thanks, Brian. One of the things that is truly unique about healthcare is that it's a process that needs to transform itself. And it's not just about hospitals, it's about how we educate nurses, how we educate doctors. Our whole system really needs a transformation that will allow us to be creative and do things differently and take care of our communities. That is not a process that's going to turn around tomorrow. It's a process that takes a long time. You know, I'm 53 years into it since medical school and still waiting for it to happen. There's been certain improvements. There's probably some steps back also. But the big difference that I see happening now is that healthcare has been controlled by healthcare. It's now time to take healthcare back to the community and get the community control, use the expertise that we have within healthcare, but to transform how we're thinking about healthcare as a whole. Healthcare is in transition forever. It will never stop being in transition. And that makes it really hard because, you know, we start to talk about what's our 3-year, our 5-year, our 10-year plan. It's very hard to create a plan when you don't know what's going to be around the corner. We've got high costs in Wyoming. Not only high costs, but the highest per capita costs in the country. Why is that? And part of it is our population density. 500,000 people spread over such a large area. We've got many hospitals that are very small size. They have lower utilization of services. So if you have a CAT scan machine or MRI machine, the way you pay for it is you keep putting more cases through. If you don't have cases to put through, obviously it's going to cost you more money per case to be able to do that. Transportation. I mean, people come up from Pinedale. It's time, it's money to do transportation to facilities. We have the highest in Teton County, we have the highest rate of uninsured population in the state of Wyoming. The dissonance between the highest per capita income and the highest rate of uninsured is pretty amazing. And then you have the issue of community needs versus business decisions. Would you run a nursing home that has 60 beds, that takes care of people in need in our community if you were a business owner and you were losing money every year? Would you keep an emergency room open 24/7 with fully trained doctors if you were losing money, if it was a totally business proposition? That's why it's a community issue. That's why it's not a business per se. So you've already heard a little bit about changing reimbursement. So there's reductions in payment if you readmit patients that, quote, the rules say shouldn't be readmitted. But suppose you're that patient from Pinedale, and it's a snowy day, and you come up to be rechecked, and you're not sure whether you're going to get better tonight or not get better tonight, and there's not care where you're going back to, and by the way, you have the 3.5 or 4 hour ride in the snow. You need to readmit that patient. But the federal government has set up rules that don't take into account geography, don't take into account weather conditions. So that's one of the issues that we need to deal with as a small hospital. There's a cost of doing business that the government has put on us. We're about to change from what we call ICD-9 to ICD-10. This is the way we look at the services that are provided. Well, it's a system that requires a complete change in the way we do business. It requires physicians in their offices to know what the rules are. And the cost of that is huge. Not saying it shouldn't be done, but it just needs to be recognized. We have a thing called meaningful use. And meaningful use is using computers in an appropriate way to help take care of patients. We all know that now, you can get on the internet, you can find information. Well, it'd be really nice to find information about a patient who was taken care of in Salt Lake City tomorrow when they come back to Jackson, and be able to get this information transmitted. Well, it's a great idea, but guess what? The systems aren't ready. So it takes time. It takes time away from our nurses taking care of patients. It takes time away from our doctors interacting with patients. So these are things that we're dealing with. There was mention about value-based payments. The trouble is we haven't really defined value. Is value in the terms of the patient who comes in and understands what they're getting or not getting, or what their needs are? Is value in terms of what doctors can provide or nurses can provide? We need that dialogue, and so we're putting rules in before we have that dialogue. So our systems, the reporting that we have to do, we're trying to get to transparency so that people in the community can understand what our infection rates are, what things we can do and can't do. But that all takes time and money. I mentioned the national decisions versus local needs. Brian mentioned that also. You can't apply the same rules in Baltimore that you have to apply in Jackson. And then the information systems. Brian, what did you tell me this morning? You spent at Hopkins $600 million on your information system? $600 million. And by the way, does it work really well? So those are some of the challenges that we're dealing with now. So Pembroke comes in to his boss, and his boss says, "This month, Pembroke, the cost of your health care and other benefits exceeds your salary, so you owe us money." It's a joke, but you know what? It's getting pretty serious. So we always talk about Jackson being different, and we are. You're right, Brian. Looking out at the mountains is pretty neat. We are, and we're not in some ways. So we have had relative isolation, but we're getting smaller due to information systems. Telemedicine today, you can have a doctor on the other end actually see the patient, listen to the heart, look at the x-ray, and be able to do that. Now, that's a great innovation. But my concern is that we're losing that interaction, the patient-doctor, nurse-patient interaction by using some of the technology. So how we use the technology is good. I'm struck, we were having Daniel Goldman come to Jackson the 15th of May, and he's the one that wrote Emotional Intelligence, and the preface to his book on social intelligence includes a term that he calls social autism. And what it's related to is the fact that we're sitting there with our iPads and our iPhones, and we're constantly interacting with text messages instead of interacting personally. As a physician who was trained a long time ago, a lot of what I thought I did diagnostically was just by looking at the patient, seeing the patient's reaction to my questions, and really having a feel of emotional attachment to that patient to help them. And I don't want to lose that as we bring in technology, although technology can do a lot of positive things for us. Our cost structure is higher because we do feel that community responsibility. It's having the nursing home. It's going out and doing wellness for our school system, which has been a very successful program. But we don't make money on that. As a matter of fact, we lose money, and thanks to some generous donors is why we actually have that program. So that community responsibility is ours, but it's also yours in the community. Everybody knows about our cost of living and our housing issues. So that adds to the burden of delivering health care in this community. And I mentioned the rate of uninsured. Well, the health of the population, what is Wyoming number one in healthy populations in the state? In Teton County is. And so we tout that, but at the same time, there are pockets within our community where there are children who are not getting adequate nutrition, where people aren't getting adequate care for their diabetes. So that's a part of outreach. We can't solve that as a hospital alone. We need to solve that as a community. So moving into the future, let's make use of our assets. We have wonderful assets here. The generosity of our community is amazing. My wife, who worked at the Community Counseling Center for many years, came here and amazed that if a patient needed medication, they had a way to get it. If they needed gas to get over the hill, they could get that, gas money. If they needed wood for their fireplace in the winter to stay warm, they could get that. We've never been in a community that was as generous as this one is. We have a really good group of providers from all different disciplines, whether it be physical therapy, nutrition, our physicians. We're very fortunate people want to live here. We should make sure we make total use of that population. Our workforce is really committed. I would trade our nurses with nobody. I think they do just a terrific job. We've got a great facility, thanks to the community that has given us the new. As a matter of fact, if you took a picture in our operating room and took a picture in Johns Hopkins operating room, they look exactly the same. We have the same equipment with our new operating rooms. We need to prepare for change, continually assess what's working, what's not, pay attention to those reimbursement changes. And, you know, there's been some talk in the community about the expansion of the hospital's physician group. Should we expand? The answer is yes, no. If we have physicians who need help to maintain themselves in this community, in this complex world we're living in, and come to us for help, then we work collaboratively with them. If we have physicians who, because of their discipline, can sustain themselves outside and don't need that help, great. So it's going to be both. It's not either or. As a matter of fact, if you really gave me my druthers, I wouldn't have any physicians work for me. I know what I'm like. Okay. So the community is our responsibility and I'm not even call us an institution anymore. I'm going to call us a community resource. And it's our responsibility to be out there for the community, but it's also the community's responsibility to be there for us and help us and give us feedback. And it's not just treating the sick, which the old hospitals used to do, but it's maintaining wellness. It's supporting population health, so our kids are all immunized, that women who need mammograms get their mammograms. You know, we're the best in Wyoming, but we're still only at 67% for women getting the mammograms they need. Supporting the needs for insured population. We tried this year to support the expansion of Medicaid, and it didn't happen. People can have different feelings about it, but we really need to move to having the barriers taken down for people to get their care. And then we need to educate our legislators and the population, which is part of what we're doing today. And so talking about survival, and talking about the way we provide care and changing and being able to change as we watch things around us. There's some silent, quiet messages out there about how things are changing. And if you think about Kodak, they missed the silent message. If you think about Blockbuster, they missed the silent messages. If you think about Pearl Harbor, an extreme example, we missed the silent messages. So this is changing all around us. We need to pay attention to those silent messages and work collaboratively as a community. I invite you all to become ambassadors and part of our healthcare system, part of the transformation that we're going to need to go through. Thanks very much.